Kashonji and Chitura sub-counties are two neighboring rural communities of about 63,000 people in the southwestern region of Uganda, a country in East Africa with a fast-growing population of nearly 35 million people. Here in Kashonji and Chitura, poverty is pervasive, and most people lack access to adequate health care, quality education, and clean water. Families struggle to pay the school fees of children, and when someone falls sick, it can often be a disaster for a family. Family members may sell off many assets such as land and livestock to pay for the health care costs, or they may not manage to pay at all. But the people in Kashonji and Chitura are resourceful and determined. Their ideas, skills, and community spirit are what led Progressive Health Partnership PHP to begin a long-term partnership with them in 2009 to support the holistic development of the community. From the beginning, PHP started very small, but the organization has big dreams.
PHP is a non-profit organization I co-founded in 2010 with my friend Eddie Zhang when we were students at Duke University. The organization is based on the idea that as members of humanity, we all deserve basic human rights, and that we must come together to pursue social justice on behalf of marginalized populations throughout the world. Most of all, PHP is about action. It is the translation of those ideas I just mentioned into practical, responsible actions so that we can make a real difference in people's lives.
Focusing on health as a human right, the organization employs a multifaceted approach in its work.
PHP's philosophy is based on a combination of service, research, and advocacy. First, we provide services such as delivering basic health care to improve people's lives. Second, we conduct research to measure the impact of our services to make sure that they're truly making a difference. And third, because service delivery and research cannot solve all of the world's problems, we also engage in advocacy on behalf of the people we serve. These three arms, service, research, and advocacy, are grounded on a community-based, grassroots approach.
Women are the cornerstone of the community in Kashonji and Chitura. They care for children, look after families, farm the land, and complete household chores. So as PHP lays the foundation for its long-term efforts in Kashonji and Chitura, it is focusing on improving health during and after pregnancy for women and their babies.
In Kashonji and Chitura, childbirth remains one of the most dangerous moments in a woman's life. But women should not have to fear childbirth. It is an event that they should be able to look forward to. And a child should not have to grow up without a mother because his or her mother died of a preventable cause related to childbirth. There is no reason why these deaths should continue to occur in the 21st century.
But improving maternal and neonatal health is not an easy task. Women are vulnerable to a variety of health problems during pregnancy. They may be severely anemic as malnutrition is a significant issue. Malaria infection is also common. Women may have HIV/AIDS, and any number of complications may endanger their lives when they give birth. Many women must walk for hours to reach the government health centers, which frequently are not stocked with sufficient supplies and medications. As a result, many women choose to give birth at home. Gender relations are also an issue. Many women do not receive support from their husbands during pregnancy, even though both emotional and financial support from men could significantly improve health outcomes.
A pregnant woman needs support. After becoming pregnant, she becomes weak. I can easily get sick from malaria compared to a woman or man who is not pregnant. This could destabilize my pregnancy. A pregnant woman needs to be supported so that she can do light work, and after she goes to the health center for prenatal care or delivery, she should find good services.
Recently, PHP launched a new maternal and neonatal health initiative called the OMUKAZI N'AMAGARA Program. The program has 3 components. First, improvements to the 2 local government health centers in the community. Second, a health education campaign by community health workers. And third, home visits to women during and after pregnancy by community health workers.
Pregnant women, mothers, and newborns are vulnerable and underserved. So it is very important to provide necessary assistance to them. For instance, before women give birth at the health center in Kashonji and Chitura, they are required to purchase gloves, cotton, delivery sheet, and soap. Because the health center generally don't have this supplies. However, most of women in Kashonji and Chitura, they are poor. They cannot manage to purchase these supplies. So it becomes challenging, and it is a demotivating factor which discourages women from coming to the health center. In OMUKAZI N'AMAGARA program, we are focusing on the period from the 3rd month of pregnancy and the 4th month after delivery. And we are trying to solve these kinds of problems.
Through the OMUKAZI N'AMAGARA program, PHP has trained 26 community health workers, referred to in Uganda as village health team members. These village health team members are residents of the local community who have stepped up to take on the role of working to improve the health of community members. Because they live nearby the people they are serving, they have the potential to make a significant impact on health.
I teach people about the time both during and after pregnancy. I also visit pregnant women. I advise them to seek prenatal care at least 4 times before giving birth. I also check for danger signs, and if a woman has one, I refer her to the health center. I keep checking on the women, and I see how they are when they come back from the health center. I will also advise them that they should give birth at the health center and save money, which can help them during delivery.
As the OMUKAZI N'AMAGARA program also supports local government health centers, PHP is working in close collaboration with the government in order to support Uganda's national development goals.
We have a problem accessing water in Kashonji and Chitura. PHP built 2 rainwater harvesting tanks for us, so women who give birth here are able to get water. PHP brought us mosquito nets that we give to every woman who comes here for prenatal visits. We think this will help us to reduce the rate of malaria in women who come here for services. PHP has given us supplies to use for assisting women during birth and for our protection, such as gloves, gauze, cotton, and others. And when we get a problem during a delivery, PHP staff members help us to take women to the hospital about 40 kilometers away from the health center.
Although it will take time for PHP to truly measure the impact of the program, Jordan Bataisiwa, the director of the OMUKAZI N'AMAGARA program, already sees a difference in Kashonji and Chitura.
If you look at the health center records in Kashonji and Chitura, before the OMUKAZI N'AMAGARA program, there are very few women who would come for antenatal care, deliveries, and after deliveries. But now, there appears to be a significant improvement in terms of the number of women who are coming to the health center.
Despite the positive changes in the community, PHP still faces significant challenges.
Our greatest challenge is related to deliveries with complications. The health centers are not prepared to handle complicated deliveries, so they typically have to send such cases to the nearest hospital, which is about an hour away by car. But many women simply are not able to make this trip. To solve this problem, getting an ambulance would be extremely helpful, at least in the short term. But what we would really like to do is to significantly build the capacity of the health centers here, say by constructing an operating room, hiring a doctor, so that they can handle complicated deliveries within the community itself.
As PHP seeks solutions to these problems, the organization will do everything within its power to achieve better maternal and neonatal health in Kashonji and Chitura.
Our goal is nothing short of perfection. We do not want to see a single woman or baby in Kashonji or Chitura die or experience significant morbidity for a reason related to childbirth. Although it will take some time to reach that goal, I believe we can get there.